After the age of 50, your heart begins to change in ways that are gradual but meaningful. These changes are not sudden, and they are not necessarily dangerous, but they do alter how your cardiovascular system responds to stress, activity, and time. Many people assume heart problems only appear when there is chest pain or a dramatic medical event. In reality, the heart evolves quietly over decades. One of the most noticeable changes after 50 is reduced elasticity in blood vessels. Arteries naturally become stiffer over time due to structural changes in the vessel walls. When arteries lose flexibility, the heart must work harder to pump blood throughout the body. This increased workload can contribute to higher blood pressure. Elevated blood pressure does not always produce symptoms, which is why it is often called a silent condition. Another change involves the heart muscle itself. The left ventricle, which is responsible for pumping oxygenated blood to the body, may gradually thicken in response to years of pressure and workload. Mild thickening can be an adaptive response, but combined with high blood pressure or metabolic stress, it can reduce efficiency over time. Heart rate variability also shifts with age. The autonomic nervous system, which controls heart rhythm, becomes less responsive. This means the heart may not accelerate or recover from exertion as quickly as it once did. You might notice that intense activity feels more taxing, or that recovery takes longer than it did in your 30s. This does not necessarily mean something is wrong. It reflects natural physiological adjustments. Cholesterol metabolism changes as well. Levels of LDL cholesterol may rise, while HDL may decline, depending on lifestyle and genetics. These lipid changes influence plaque formation inside arteries. Plaque buildup, known as atherosclerosis, often begins decades before symptoms appear. After 50, the cumulative effect becomes more relevant. Blood sugar regulation is another major factor. Insulin sensitivity often declines with age, especially if muscle mass decreases and physical activity levels drop. Elevated blood glucose contributes to inflammation and vascular damage, further affecting heart health. Inflammation itself becomes more prominent over time. Low-grade chronic inflammation can influence arterial stiffness and plaque stability. It is not a dramatic process, but a slow one influenced by diet, stress, sleep, and activity patterns. Hormonal changes also impact the cardiovascular system. In women, estrogen decline after menopause affects vascular protection. In men, gradual testosterone changes can influence body composition and metabolic risk. These hormonal shifts alter the environment in which the heart operates. Importantly, none of these changes automatically mean heart disease. They represent risk factors and physiological transitions. The heart after 50 is not failing by default. It is adapting to decades of exposure, lifestyle choices, and metabolic signals. The key difference between healthy aging and cardiovascular disease often lies in how these factors are managed over time. If the heart changes after 50, the next question is what can realistically be done to support it. The most powerful intervention remains regular physical activity. Aerobic exercise strengthens the heart muscle, improves circulation, enhances endothelial function, and supports healthy blood pressure. Brisk walking, cycling, swimming, or light jogging performed consistently can improve cardiovascular efficiency even in later decades. Resistance training complements aerobic exercise by preserving muscle mass and improving insulin sensitivity. Stronger muscles reduce metabolic strain and improve glucose control, indirectly protecting vascular health. Nutrition plays a central role in cardiovascular resilience. Diets rich in vegetables, fruits, whole grains, healthy fats, and lean protein support lipid balance and reduce inflammation. Reducing excessive refined sugars and highly processed foods helps stabilize blood sugar and decrease metabolic stress. Sodium intake moderation can assist in blood pressure management, particularly for individuals who are salt sensitive. Sleep quality influences heart rhythm, blood pressure regulation, and hormonal balance. Fragmented sleep or chronic sleep deprivation increases stress hormone levels and can elevate blood pressure over time. Establishing consistent sleep routines supports cardiovascular recovery. Stress management is equally important. Chronic psychological stress activates the sympathetic nervous system, increasing heart rate and vascular tension. Over time, persistent activation can contribute to hypertension and metabolic disruption. Practices such as controlled breathing, meditation, or regular time outdoors can help regulate nervous system balance. Monitoring key health markers becomes more relevant after 50. Blood pressure, cholesterol levels, fasting glucose, and inflammatory markers provide insight into cardiovascular status. Early awareness allows for early adjustment. Hydration supports blood volume and circulation. Even mild dehydration can influence heart rate and perceived exertion during activity. Maintaining adequate fluid intake supports overall cardiovascular stability. Weight management, particularly reduction of excess abdominal fat, decreases strain on the heart. Visceral fat is metabolically active and associated with increased cardiovascular risk. Even modest reductions can produce measurable improvements in blood pressure and lipid profile. It is also important to recognize warning signs that should not be ignored. Persistent chest discomfort, unusual shortness of breath, dizziness, or unexplained fatigue warrant medical evaluation. Normal aging should not cause severe or progressive symptoms. For many people, however, heart health after 50 is largely influenced by daily habits rather than destiny. The cardiovascular system remains adaptable. Blood vessels respond to improved diet and exercise. Blood pressure can stabilize with consistent lifestyle changes. The heart muscle itself can become more efficient with training. Aging alters the baseline, but it does not eliminate capacity for improvement. The objective after 50 is not extreme performance. It is durability, resilience, and long-term function. A heart that receives consistent movement, balanced nutrition, adequate sleep, and regulated stress signals often remains strong well into later decades. The changes that occur after 50 are real, but so is the ability to influence them. Heart health is not determined by age alone. It is shaped by accumulated choices and ongoing adjustments. The earlier supportive habits are established, the greater the long-term benefit. Even small, consistent actions compound over time. After 50, awareness becomes more important than fear. The heart is not simply aging. It is responding, and how it responds depends greatly on the signals it continues to receive.